Eating disorders are serious illnesses comprised of physical and cognitive symptoms that can have profound consequences for a person's overall health and quality of life. They include bulimia nervosa, anorexia nervosa, binge eating disorder, and other specified feeding and eating disorders, otherwise known as OSFED. They tend to develop during adolescence, but may emerge at any point across a lifespan. Eating disorders affect both men and women, but are most often diagnosed in women. According to the Public Health Agency of Canada, approximately 3% of women will be affected by an eating disorder in their lifetime. Bulimia nervosa is characterized by a cyclical pattern of binging, the use of compensatory strategies, and viewing shape and weight as core determinants of self-esteem. Binging means eating a large amount of food in a brief period and experiencing a sense of loss of control. Compensatory behaviors are strategies to get rid of unwanted calories. They include self-induced vomiting, abuse of laxatives, diuretics, excessive exercise, and fasting. Anorexia nervosa is characterized by significant weight loss due to restriction of food intake and extreme fear of gaining weight or becoming fat. Feelings of fatness and viewing body shape and weight as a core determinant of self-esteem. Some individuals with anorexia nervosa also experience episodes of binging and use of compensatory behaviors. Binge eating disorder is characterized by recurrent binge eating and no use of compensatory behaviors. Individuals with binge eating disorder commonly report dieting between binge episodes. This dieting behavior is quite different from the fasting or extreme dietary restriction frequently observed in bulimia nervosa. Other specified feeding and eating disorders include those who do not meet the full criteria of all the aforementioned eating disorders, yet still exhibit life-interfering symptoms to physical health and cognitive functioning. Feeding disorders are characterized by disturbances to eating-related behaviors, eating non-nutritive or non-food substances, repeated regurgitation of food, or aversive sensory experience related to eating. Eating disorder behaviors typically occur when an underlying struggle, an emotional, interpersonal, or life challenge exceeds a person's capacity to cope. Despite severe health consequences, eating disorders can be valued by individuals. They may enhance self-esteem, be a means of communication, address a need for control, or provide a way to avoid painful emotions. Treatment may be individual or group-based and can occur in outpatient or inpatient residential settings. Effective treatments help patients examine the costs and benefits of change, explore the functional role of the eating disorder, teach distress tolerance skills, and provide assertiveness training. Therapies that have received the greatest empirical support include cognitive behavioral therapy, CBT, interpersonal therapy, dialectical behavior therapy, DBT, and family-based therapy. CBT focuses on relations among thoughts, feelings, and behaviors that contribute to disordered eating. In interpersonal therapy, the focus is on improving relationships and social functioning in an effort to reduce problematic eating behaviors. In DBT, patients learn skills in mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. Family approaches focus on assisting the family to work together in overcoming the eating disorder. The treatment that has received the greatest empirical support for bulimia nervosa and binge eating disorder is CBT. Research investigating the best treatments for anorexia nervosa is ongoing. A comprehensive approach that addresses motivational issues, weight restoration, and underlying psychological issues is recommended, with family therapy a critical treatment component for younger clients. You can consult with a registered psychologist to find out if psychological interventions might be of help to you. Provincial, territorial, and some municipal associations of psychology often maintain referral services. For the names and coordinates of provincial and territorial associations of psychology, visit the following URL.